This mom of 3 has been trying to make light of the situation. She co-designed this t-shirt expressing the frustration of Ontario parents that's selling out online.
In the coming days, an announcement will be announced.
But all jokes aside, today's announcement was a relief.
That was very exciting. I want the government to take our mental health seriously. I've got this one, we've got a baby and a toddler. So trying to stretch myself to give everybody what they need has been tough.
Ontario is the last province to keep kids out of physical classrooms. In Toronto and the surrounding areas, students will have been out of school for 5 out of the last 12 months. That's not counting the regularly scheduled holidays. But the back-to-school plans will have to take into account the new coronavirus variants.
We've really elevated and enhanced the measures in place.
New measures include mandatory masking for students grades 1 to 3 and expanded asymptomatic testing in schools. Shamila Shakil has 3 kids going back on February 16th. She's not sure new measures are enough.
What's going to make it safe that where it wasn't safe in December? And we're not hearing that piece. We're not hearing what they're doing because class sizes aren't getting reduced. They haven't really done much about ventilation.
But it's about balance, and some experts say keeping kids at home for longer does another kind of harm. This doctor was among 100 who signed a letter to the government to reopen schools.
When people talk about safe, it's not just about being safe from COVID. It's about doing what we need to do to ensure our children's, long-term safety, and school is a big part of that.
And that's something Rebecca Ackerman agrees with. While she worries for her daughter's safety, she says learning from home was just not sustainable. She hopes this time she's back in class to stay. Sumanac-Johnson, CBC News, Toronto.
Okay, so at the heart of all of this, the unpredictability of the variants that we know have a toehold in Canada. So joining us now to talk about that, infectious diseases specialist Dr. Zane Chagla. Dr. Chagla, what is the obstacle to developing a fuller picture of how much of the variant is actually out there? Test more aggressively.
So many reference labs are starting to develop a screening test that then gets reflexed to sequencing testing, which is the higher level testing that confirms these variants' presence. The problem is many of our tests, for me generally, would be done at one of hundreds of different labs. My positive sample has to then go to that reference lab, has to be screened, then has to go get sequenced. And so there is a delay to getting it, not to mention, obviously, the resources needed to make sure that everyone has this available testing. So unfortunately, at the time being, not everyone has a chance to get this tested, although it is increasing day by day.
So until we develop that capacity, can we extrapolate with the data we do have to figure out how much of the variant is out there?
Yeah, it's hard without a denominator, but we are seeing increasing number of community cases day by day without any clear travel link. And I think the numbers are starting to creep into the 1% to 2% range as time moves on. So I think we can get a sense as testing scales up, we're going to start seeing more and more and more as we start seeing more of that iceberg.
Okay, Dr. Chagla, good of you to join us. Thank you so much.
No problem.